Hi, my name is Tom Lynch. I'm the director of the Yale Cancer Center, and I join you today from Sarah Cannon. Lung cancer is the leading cause of cancer death in the United States and Western Europe, and increasingly in Asia now, the leading cause of cancer death. It's a global epidemic caused principally by tobacco, but we also know that in the United States, 15% of all the lung cancer occurs in people who didn't smoke significant amounts of tobacco. The big breakthroughs in lung cancer over the past 10 to 15 years have been in finding drugs that work specifically for selected genetic types of lung cancer. EGFR mutated lung cancer benefits from a drug called erlotinib or gefitinib, or maybe the drug afatinib. Lung cancers that have the ALK translocation benefit from a drug called crizotinib, which work in that setting. So the biggest breakthrough in lung cancer in the past 10 to 15 years has been understanding that it's not just one disease, that we need to do what's called molecular profiling to determine the abnormalities within a given patient's cancer, and that will make a huge difference in bringing new medicines to patients. And so that whole concept of molecular profiling is essential in looking at this disease. So CT scans have made a huge difference in early screening trials so far. They haven't started being done a lot by patients in the community, but in the year 2011, we saw publication of the first big study that showed that the CT scan for a smoker might be the mammogram for breast cancer, meaning the CT scan may be able to pick up, in fact is able to pick up, smaller lung cancers where treatment can save lives. So what we're seeing right now is that discovery moving from the New England Journal to actually beginning to impact patients at the community level. One of the big barriers is convincing insurance companies to cover CT screening. In fact, it's an expensive test, and patients often can't afford that unless it's covered by insurance. My prediction is insurance companies in this area want to do the right thing and want to be at the right place in terms of offering services to their members and their subscribers. And I think we're going to see more coverage of CT screening for people with a smoking history. In my opinion, people who are over the age of 50, who have smoked more than what's called 30 pack years, which means more than 1 pack of cigarettes a day for 30 years, or a half a pack of cigarettes a day for 60 years, both of those equal 30 pack years, or 2 packs of cigarettes a day for 15 years, that equals 30 pack years. People with more than 30 pack years over age 50 should think about low-dose CT screening on an annual basis. For someone who's newly diagnosed with lung cancer, the real key issue with the doctor is to determine, first, what's the stage of my lung cancer? Is there a chance this could be treated with surgery or with radiation? Second, what's the type of my lung cancer? Is this one of the molecularly defined types of lung cancer or not? Third, what are the specific treatment options for me? Do I need chemotherapy? Do I need surgery? Do I need radiation? And what about the molecularly targeted agents? And then most importantly, whether it's lung cancer or any cancer, what about clinical trials? What are the clinical trial options for me in this stage of disease?